Yes, doctor.
Yeah, so did you download the materials I gave you, including the books?
Yes, doctor.
All right, so I hope you are reading them, no? Because it will be useful. The video also, you could have access of our previous lecture, it's there, right?
Yes.
Okay, so we'll now continue with our class. Last week we start here. I really would like to speak about psychosocial health. Then after that, we'll try to find out what could be some of the causes of illness, right? Based on the presentation that I'm going to show to you, particularly in terms of psychosocial care. Now, as a human being and as a person, we are governed by a very specific need. All our actions, all our behaviors, all our motivations are towards the achievements of the basic needs that we have. These have been emphasized by one of the well-known humanistic psychologists, no? Abraham Maslow. And almost every single person utilizes his Maslow's hierarchy of needs because this is actually true to life, true to all of us. Okay? And in that particular hierarchy of needs, Abraham Maslow mentioned very specific needs. We have to achieve that one after the other. Okay? Now, whenever we are not going to achieve it, there will be deficiency, there will be want, there will be need. Therefore, we cannot advance to the next tier, to the next level. Like, for instance, if you're going to look at a poor fellow, at a poor person, so definitely a poor person has deficiency on everything. He does not have any money to buy for food. He does not have anybody to buy for shelter, for clothes. In short, he is always in need. He is always wanting. So, what do you think will happen to him? Will he have very good self-esteem? Will he have a feeling of security? What do you think?
No, if he missed the basic needs, he will not be able to move to another level.
Very good. You know this. Now in the police, if you're going to analyze the people in the police, isn't it? Why do
Yes.
people commit crime? Why do people do things that are unthinkable just because of one thing? If we're going to understand them, if we're going to look in their needs, no, something like a person with good self-esteem may always think highly about themselves, so they are secure, they do not need anything other than boosting their self-esteem, boosting the way they look at themselves. But if you are deficient on your lowest level, then you tend to satisfy that by all means, isn't it? If you think that you need money, what do you think?
صح.
Yeah. Okay. If you think that you need money, what do you do? Of course, you're going to look for job. But if you will not be able to find job for a long time, what do you need? You commit crime. You do not think about other people's life because the center of the world will be you. The center of the world will be your own satisfaction. Then, if you're going to do that, you will become sick. That will be the problem. So let us try to understand Maslow's hierarchy need. So on the lowest level, this is pertaining to our survival needs. Survival means the need of our body: food, water, sleep, exercise, and so on and so forth. These are all the things that we need in order to survive, the most basic things. We cannot survive without water. We cannot survive without food. Of course, we would always want to have food at home. When we go home, we would like food. When we would like to drink, we would have water. But if you do not have this, then there will be a very big problem. You tend to fill in the gap by all means, at all costs, at all times. So you do not think of any other level already. Yeah. So in that case, there will be stagnation. Now, as a humanistic psychologist, Abraham Maslow think about that. What makes a better person? Now, his study actually involved heads of states, including Abraham Maslow. He studied so many good people, leaders, what made them successful. You know what? He was able to realize this. Then later on, based from his study, he came out with this different level. So the most basic thing of man that we need to think about will be survival needs. These are physiological needs, biological needs, among others. Okay. Now, after satisfying that, we'll go to the next stage, security needs. The need for shelter, the need for safety, the need for protection. You see? That's why we will involve here, including our attachment with other people, our relationship, and so on. You see? So we need to have basic security. When we go home, we feel so secure. We are not thinking about food anymore. We are not thinking about money anymore. We are not thinking about water anymore because we have them. The next thing that will go will be on the higher scale, and that is our security needs. At least wherever we go, we will survive, we will live, and we are secure. That is actually the next thing. Yeah, that is security. The next one is love and belongingness. The way we are going to relate with other people. So here, we'll try to make a family, we'll try to connect with people, we'll try to find a very good relationship, we'll try to find acceptance. If we have a family, our family loves us. Why? Because we'll be able to provide them foods already. We're able to provide them house already. We're able to give them cars already. So the next thing that will be in line will be our love and belongingness. This is pertaining to your social needs. So, sometimes a lot of people are looking into this, but they found it. Other people do not find it. And if they will not be able to find it, then there will be a problem in that case. They will feel so alone. They will feel so depressed because they will think that no one loves them. If you're going to think about that, what happens next? Of course, definitely you are going to look at yourself differently. You will not have a very good view on yourself. You may not develop self-esteem. You see, once that you satisfy social needs, your love and belongingness, you can actually go on the next level. That is the respect of yourself. You're going to look highly and high regard on yourselves. No, you're going to gain the respect of others, your self-respect, and you can actually say, "I'm accomplished." You're happy with your job. You're happy with whatever you are, whatever state you are. That is the meaning of self-esteem needs. In that case, you can be able to give. You will be able to give to other people because other people respected you and you respect other people. You look and do have a high regard on yourselves. That is the meaning of self-esteem. Everybody would like this, isn't it? Right? You want to feel good. Who does not want to feel good? Yeah? You see, everybody would like to feel good. Everybody would like to be told, you're very good, isn't it? Yeah. Because if we are going to have that, we think highly about ourselves. That's the thing. Now, when there will be a problem here, everything will break down. But if you are very happy with yourself, then you can go to the next level. That is self-actualization, which is actually very difficult to reach. Every single human being would like to achieve this, wherein you can be whatever you want. Yeah, you cannot be affected anymore by anything, by the need for love, by the need of security, by the need for food, by the need of affirmation and self-worth. You do not need those things because you are totally at ease with what you are doing. Your ability to do things. You are not anymore impressed by big houses, by good cars. You're just happy being what you are because you can do whatever you want to do. In that case, you can create. You will be creative. In terms of the spiritual, you are on the highest tier already. You are already on self-fulfillment, the fulfillment of all your potentials. Who does not want it anyway? Every single human being would like that, no? At least in our lifetime, we would try to achieve this. But you know what? If you're going to review the world right now, it looks like other people, majority of us, are still looking for on the lowest. survival needs or on security needs. These are the most basic thing that we would like to. If we are going to have that as nurses, then there will be a problem. How can we give care when we are still looking for survival, when we are looking for security needs, and so on and so forth? We can only give care when we know ourselves, when we have a very good idea about ourselves, when we have the capacity to care, when we have the capacity to love, when we have the capacity to enter into a nurse patient relationship, when we can actually respect other people. That is on this level that we can always provide psychosocial care. That is from social needs up. Below, if you're actually looking for that, definitely it's very difficult to give, isn't it? Just like those people who are starting to work. No, if you are just starting to work, that means to say you are just accumulating money. So you are just looking into survival needs and security needs. After that, when you have everything already, that will be the time that you can give. You look out for relationship and you can give to other people also. That is the thing. This is usually the problem that we have, no, in psychosocial care. What we can give to other people. We have to recognize the fact that people actually come to us because they need something. When they need something, we can also give that. Now, we can only give when we do have all these things, right? Starting from social needs. How can we give ourselves to other people? How can we give service to other people when we ourselves cannot give it because we are deficient in it? That is the thing. If our family loves us and we are at ease with ourselves, we have very good relationship, that will be the time that we can view ourselves highly and fruitfully so we can actually give psychosocial care to others. That's why if you're going to be in prison, that's the most beautiful place that you could observe human beings. In prison, you can see struggles. You can see people who are struggling. Why they're there? They could have committed a crime, but for what reason? It could be for survival. It could be for security. It could be for assertion of something else. That is the thing. Actually, in mental health, that's the best way to study. A lot of people are there trying to survive, trying to do something to the extent that they violate the laws already. That would be the problem. Now, what can we do as nurses? We have to give them. We have to understand them. We have to give them psychosocial care. That's why it is necessary for us to understand the different causes of psychosocial illness. That is the thing that I really would like to pinpoint to you on the next topic, on the next slide. I started first with the idea of Abraham Maslow, Maslow's hierarchy of need. Maslow studied human beings, good human beings, accomplished human beings, like the former president of the United States. And he is a well-known contributor to humanistic psychology. He is a first and foremost humanistic psychologist. The nature of human being, the psychology of human being as such. So now these are some of the key issues in response to illness that we look for, that I actually mentioned to you a while ago. The first thing that we have to look into will be altered self-esteem. What happens to an individual? Now, self-esteem is the individual's personal judgment of his or her own worth. The way we value ourselves. How do we equate ourselves? How do we give valuation of ourselves? Are we worthwhile? Are we responsible? Are we happy and contented with ourselves? Now, take note, the root of self-esteem are really in the early parental and social relationships that we have established from our experiences. Now, according to Abraham Maslow, self-esteem was actually placed at a high level, indicating that this need can be accomplished only when the more basic needs are fulfilled. That's why self-esteem is on the poor level. That will be difficult to achieve. Why? Because according to Abraham Maslow, we have to achieve first the first three before we can always look into this. We cannot go directly to self-esteem. We can never do that. Imagine after graduation, you already have self-esteem. That will not be possible. Why? Because you are still trying to survive. You're still trying to make a family. You're trying to be respected and to respect other people. You're trying to find your very good relationship. You're trying to find the relationship that you deserve. In short, you're trying to look for a husband or a wife or a family to love and to give love to. You're trying to look for a community where you are going to belong to. So this is exactly the point. That's why the two highest levels, the self-actualization and self-esteem, would be most deficient in any way somehow among people like us, among people who need our psychosocial care. So this is one problem that we may actually find, altered self-esteem. Once in a while, if you're going to review your life habit, you can question yourselves: Am I worthwhile? Am I a very good person? Something like you doubt already. You doubt yourselves at that stage of life. At this stage of life, sometimes we doubt ourselves. The moment we doubt ourselves, then there will be a problem. Anxiety will be there. Insecurities will be there. Problems will be there. The first three chairs will actually be reflected on your behaviors, and there will be a very big problem. You get the point. The moment that you're going to have a problem with self-esteem, there will be insecurities, there will be loneliness, there will be depression, there will be sickness. You see, your physiological health, biological health will also be affected. You get the point? So self-esteem is one way. So this could be the most important thing that we have to look for in caring for human being. Now, let's say you try to look for a patient in your hospital. When you are working for a patient in a hospital, what happens to them? We totally cut them from their immediate environment. We totally cut them from their family member. So the second level is already affected. The third level is already affected. The security which is anchored to the relationship is already altered in that particular case because we disconnect them from their family. The moment they are hospitalized, there is a disconnection. So definitely the first thing that you will have will be a problem in the alteration of self-esteem. Then there will be anxiety, there will be fear, there will be uncertainties. That will be the point. The next issue that we will look into in response to illness will be this: altered body image. You see, imagine a patient in the hospital. What happened to them? Supposed to be, we need to survive, we need to live, and if we're going to live, our body must be very healthy. Why is it that the patients are in the hospital? So there must be something, there must be problem. So they are going to view their body as if that is imperfect. So altered body image will be there, especially when someone found to have a tumor, to have cancer, to have cuts. There could be alteration in body image, or maybe obesity alone. There could be alteration in body image. Body image is a mental picture of a person he has on his own body. Really? What do you think when somebody will tell you you're obese? What do you think when somebody will tell you you have you need to lose weight? You see? Because your sugar is high, you need to lose weight. Then you began and you start to question your own body. Am I too fat that I need to lose weight? That will be the problem. And there will be insecurities, there will be anxieties as a result. So we cannot achieve self-esteem, we cannot achieve self-actualization as long as there will be alteration of body image. And we may not have self-respect. That is very essential factor if you have self-esteem. This is significantly influence the way a person thinks and feels about himself. The self-esteem is anchored on feeling good. The moment you question about your body, there will be alteration in your body image, then you may not have to have self-esteem. No? So that's the problem. That's why a lot of key issues that we may encounter here, there will be a development of maybe anorexia nervosa, see? So, or bulimia nervosa. when you are bulimic or when you are anorexic, there could be a problem, your inability to eat, because you are getting fat, so you do not want to eat. That is the thing. So there will be altered body image. That's one of the issue that we have in response to illness. I am sick, therefore my body is not perfect. I have diabetes, therefore my body is not perfect. I am obese, therefore my body is not perfect. That is the thing. You understand what I'm trying to emphasize here? People, class, do you follow
Yes,
me?
yes, we are following you. We are
Okay,
following you,
good.
doctor.
Why do you think people need to exercise? They would like to feel good, isn't it? Yeah. So that's the immediate thing that we look
Yeah,
for.
yeah, doctor.
So we would like to feel good. We would like to, at least every single moment of the day, we
Are
would
you
like to
ready?
achieve. Yeah. We would like to achieve self-esteem and self-actualization. And we would like to have a very good image on our body, right? Am I beautiful? Sometimes self-admiration. If you're going to face your mirror, isn't it? I am so beautiful, I am so handsome, something like that. Self-affirmation, we call it. There is no problem with that, no? If you do that alone, right? Of course, do not tell that to other people. You say, I am very beautiful, I am very handsome. Let the people actually tell that to you. But of course, in the privacy of your own room, you could always tell that. You could always say, hey, you are so good today. Hey, you are so beautiful. Yeah. So that to keep you at ease with your body. So that you can actually affirm whatever you think about who you are and what you are. That is the only way. But of course, when you are sick already, then there will be a problem in terms of looking into the body image. There will be alteration of body image. That is the thing. Another one, when you are ill and you are powerless, right? The instinct of every human person, every human being is to control all the situations that they are into, isn't it? In and out of himself. You would like to assert power everywhere you go. You would like to show to people that you are in control. Now what happens when you are sick? What happens when you are ill? You fall out of control. You cannot even control your health. You cannot even control the illness. So there will be a problem. That problem is called powerlessness. No? Just like people. I like this example, you see? That's why if you're going to look at the behavior of people in the hospital or in the prison, I can always relate to prison. You know why? Because you can see a lot of behavior in prison. The moment you put someone into prison, they become powerless. So they try to assert themselves, assert their power by doing something, by becoming aggressive. You see? You
Doctor,
cannot,
what do you mean powerless? They become
yeah,
powerless. They will be
powerless.
more aggressive.
No, no, they would like to assert because they feel that they cannot control the situation. Of course, when you are in jail, you cannot control your situation. You know why? You cannot even go out from the prison. You cannot even go to somewhere else, that you want. There is a freedom of movement, isn't it? You would like to
Yes, yes.
control whatever happens to your life. But simply going outside, you cannot do. So what
Mm,
happens? When you are sick,
okay.
when you are sick, you are also powerless, isn't it? You feel that?
Yes,
Why am I here in the hospital? I cannot control my situation. You see? I cannot cook for
yes.
my children. I cannot prepare my children to go to school. I cannot go to work. I cannot do anything. So sometimes we have to understand them that they compensate by shouting at us, you know, by becoming aggressive, because they would like to assert their power in the end. This is the thing that we should do and we should understand as nurses. The moment
Yeah.
that we encounter them like that, very aggressive and very violent, we shall understand. Maybe they have a feeling of powerlessness. You get it? And that they are trying to
Yes, I
assert.
get.
Okay. So powerlessness is a perceived lack of personal control because we would like to control our life at all costs, by all means, including, you see, how do we control our lives? We dictate what we want. When we want to eat, we eat. When we would like to sleep, we sleep. When we would like to go out, we go out. When we would like to shop, we shop. Isn't it? That is in complete control. The moment it stops because of illness, then there is a problem. You put a person into the hospital because of illness, then definitely that person cannot go home and take care of his family, right? Then they become powerless. Now, individuals need to maintain a sense of power and control over destiny and environment. This is the thing that is lost. So they have to find it somewhere. And who will give that? It will be us, nurses. You see? We try to find a way in our little way to help them regain their control. You know, something like they can express themselves by experiencing play therapy, or maybe we can initiate some sort of cooking up. You know, there are so many activities that we could actually do in order to rechannel this frustration that patients may actually have. Now, the loss of this sense of control can negatively affect an individual's view of his or her effectiveness. And illness will consistently forces the individual to face or her powerlessness over the situation. Illness will always have a negative expression to somebody power. So it will alter. All right. So that is exactly the main point. So patient will respond to it violently or in different way. There are so many responses that the patient may actually come into. Once that they are ill, they are very powerless. Now the patient may compensate by all means to show that he is still in control. That's the thing. So we have to recognize that as nurses. See? So another response that a patient may actually have if they have illness is loss. Definitely loss. Actual or potential. Actual loss, loss of income, loss of relationship, loss of opportunity, potential loss. They may lose salaries and so on. But actual or potential loss is any situation in which something a person values is rendered or threatened to be rendered inaccessible, like the access to have a decent income, access to money, access to people. The loss occurs throughout life as we experience changes in relationship, inability to reach an expected goal, and disappointment in others. You see, anytime we have an emotional investment in someone or something, when we have already established our relationship with somebody else, now we are vulnerable to losing it, especially when we have established our loved ones. No? So what happens is that we could actually be disappointed in the end. If we are going to lose our limb, then we could be disappointed in the end because we will not use our limb in order to do something better and fruitful that will be beneficial to us and to society. If we are going to lose our sight, then there will be a problem. Illness entails something to be lost, potential or actual. That is actually the main point. You see, if you have cancer, what happens to you? You may not go to work because you will go for treatment. You will lose your work. You are already attached to work. That is the problem. Actual, you lose your job. Potential, you lose your income. If you lose your income, you lose your family. You know why? Because if you are a single person, if you have a family and you are just supporting the family alone, that will be a big problem. You cannot send your children to school. That is a potential loss. You cannot work because of illness. Therefore, you cannot support your family to live a decent life, even to go to school for your children. That will be an understandable issue that we are going to deal as nurses. Sometimes we forget about this when we are working in the hospital. You know why? We're just always concerned about sickness, about illness. We really would like to treat them, but what about the psychosocial aspect of it? Every single individual who is hospitalized will grieve. will have a feeling of loss. That is actually the key reaction that we have. So we, as nurses, we can always give psychosocial support to our patient. You know, you have to observe your nurses. If you're a nurse, no manager, you can actually see how much the patients are actually grieving because of this. All right, moving forward, hopelessness is another issue here in response to illness. But if you are ill, it is guaranteed that you may lose hope, especially when somebody will tell you you have cancer. You cannot go to work anymore because you have this illness. You may not survive for long because you have this illness. Remember, your life will be threatened. Now, remember, hope is a very basic fundamental of life. Every person must be guaranteed to think this way, to have this feeling. No matter how bad the situation may be, your ability to hope for improvement will help you get through it. If you have an illness, this is the thing that will be reinforced. Because the moment that a patient is actually gone in the hospital, is admitted in the hospital, the tendency is that they will lose hope for the meantime. I am hopeless, especially when they do not know what's going to happen to them, when they do not know what's going on, you know, and when there will be a big problem about their physical health, biological health, much more. Okay? Hopelessness is the sustained subjective state, personal state in which you see no other alternative or personal choices available in solving your own problem. You'll just give way. Like, for instance, as I give you the example a while ago, if you are a breadwinner in the family, you're alone. You are single-handedly supporting the family. And all of a sudden, you become ill and you are admitted in the hospital for a long-term treatment. So definitely you'll think that you will lose your job. The moment you are going to lose your job, as I mentioned to you earlier, you may lose the support for your family. If you lose the support for your family, you may not give a decent life to your husband or wife, or you may not send your children to school. Then you just accept it. Your situation is hopeless. You cannot do anything. Patient would feel that way. Now, the lack of hope can develop from an overwhelming loss of control. And this is always related to despair, helplessness, apathy, and eventually clinical or severe depression in the end. Sometimes, if we are very, if we lost our resilience, we feel this way also, hopelessness. Hope is a basic nature of life, a fundamental part of life, and hopelessness is also there to counter hope. You see? That's why there are still people who are getting depressed. If we are always hopeless, then there will be people who will be hopeless also. If we are having hope, then there will be happiness all throughout. But that's not the reality. There are still people who will encounter hopelessness in the end.
Excuse me, doctor.
Yes.
I will start giving vaccination, so I will not be able to continue.
Yeah, you will always have this later on. You can view the video. You have seen the video, right? My first video.
Yes.
So I'll continue and then get the video later on. Okay, the same site.
Thank you.
Yeah.
Thank you so much.
Okay. You have any question?
No, it's clear.
All right. I will continue now. Guilt is another fundamental issue that we may actually have. Guilt is self-blame and regret for some real or perceived action. You see? So this is running towards us, the blaming of everything that happens around us toward us. And that is very sick, you know. So let's say, for instance, again, another example, if you're ill, you may actually have a feeling of guilt because you may not anymore sustain the family. Everything rests on you, yet you are sick. Therefore, you are blaming yourself. Why is it that you become sick? That is the normal issue that may actually be happening. No? It's a painful emotion, we have to admit that can negatively influence our behaviors, our relationship, and our emotions. And on the other hand, conflict within relationship can occur when an individual feels guilty about resentment that his or her needs that are not being met. One way or another, that is actually the point. Like, for instance, as I mentioned to you earlier, you're in the hospital, you cannot go to work, you will lose your salary, you cannot sustain the good life of your family members. You feel so guilty. And you cannot actually feel, you cannot provide for your family. You feel that you cannot provide for the family, therefore you are blaming yourselves. This will always be the response that a person with illness may actually have. Potentially, we have to deal with this. So as a nurse, our psychosocial report will be to look into it, identify it, then we enter. I will teach you later on how to do it. So we design so many psychological therapeutic regimens that we can actually use in order to help patients who do have psychosocial issues and problems. Moving forward, anxiety. As I mentioned to you earlier, anxiety is the universal thing that we may actually have. Who does not feel anxious every day? No? Everybody. Me too. We are anxious about going to work. We are anxious about becoming late. We are anxious to be reprimanded. Yeah? But the level of anxiety must actually be different because there are different levels as we know it. If our anxiety is on the level of mild to moderate, then that will be okay because these are manageable. Mild and moderate anxiety will actually help us to achieve our goal. While severe anxiety, the panic attack, will render us dysfunctional. A person who do have illness may actually have this feeling. The anxiety may be high because they cannot go to work. They cannot provide for the family other than guilt, other than problem in self-esteem and body image or alter body image. They may develop anxiety, Anxiety is usually a universal, primitive, and pleasant feeling of tension and apprehension towards something. In the definition of Sigmund Freud, this is actually a result of battle between id and superego, right? Anxiety is a warning signal that tells you have to do something, like in the case of stress. Anxiety may be very helpful to us because it will help us prepare. Let's say, for instance, you are anxious that you are going to be fired from your job. What are you going to do? You prepare. See, you look for another job. That is the basic thing that you can actually do. That's exactly the point here. So the reason why anxiety is also good because it will help you to prepare for something else, especially when anxiety is on the level of mild to moderate, where the level of functionality is not affected. Anxiety is an important motivator of behavior that makes people act or change to reduce the uncomfortable feelings of tension. We really would like to eliminate this every single day. That's why we use coping and defense mechanism. Now, as I mentioned, low to moderate levels of anxiety can enhance learning in action, while severe anxiety may be reduced by using defense or coping mechanism, as the unconscious self tries to protect us from this discomfort. Anxiety is always uncomfortable. We would like to have a tension-free life, but unfortunately, it's not going to be the point. That by all means, at all costs, we should be anxious one way or another. Every single day we do have this. Every single day we have this. No, our anxiety to go to work, we may be late. Our anxiety, why is it that whenever we leave our house, we could have actually felt that we have not turned the gas off. So there is a tension that actually happens within us. Are we going back or not to go back in order to check if the gas stove is turned off or not? So things like that. These are normal things that will help us to become a better person. No, but anxiety, as a result of our illness, will always be there because the patient may always look into the unknown, especially when it's their first admission in the hospital, when they know that the illness that they have may actually be life threatening. So there is always this feeling of anxiety. As a nurse, then as a person who can actually deliver psychosocial care, this is the first thing that we have to look into, no? Anxiety. So this is one of the key issues that we can observe from a person. All right. So anyway, this is how our body react, our emotional reactions, psychological reactions, and body reactions. That's what we do. So the only way that we can actually do is to help ourselves to overcome that. When we do have anxiety, then we have to overcome that also. How do we overcome that? How do we help ourselves? Remember, as I mentioned to you, anxiety is a byproduct of the conflict between id and superego. I believe in your psychology, your teachers would have mentioned about the three structures of personality. That is id, ego, and superego. Id is your current self. Now, ego is the voice of your, superego is the voice of your conscience. Id is the voice of animalistic desire or behavior that will always wanting to be satisfied. So id and superego checks. So as a result, the ego is confused. The ego develops state of anxiety, and consciously we utilize defense mechanism in order to lower down the effect of anxiety to the ego. We call that as defense mechanism because our reaction is unconscious. But if our reaction will be conscious, we call that as coping mechanism. Okay? That is the main difference between the two. Defense mechanisms will protect the individual from threats, the feeling of inadequacy, and unacceptable feelings or thoughts. They are unconscious most of the time. Mental processes used to reduce anxiety. By all means, our body needs to do that because anxiety is really, really unwelcome and uncomfortable. The moment you're going to entertain that, it will render you to dysfunctionality, then it will become pathologic. You need a psychiatrist or psychologist for that matter to help you overcome the severe anxiety or panic attack that you may actually have. Okay? So another one, a defense mechanism is very useful because every single person utilize that. No, each time a defense mechanism reduces is going to be used, it will reduce the feeling uncomfortable feelings as a result of the anxiety. Then it will always provide us most of the time positive reinforcement. But although anxiety sometimes can always be reacted on by defense mechanism that would always be negative, also like in the case of regression, that I'll tell you about in our next topic. No. Now, on the other hand, coping mechanism is a conscious process. We know what to do. No, these are conscious methods that you, as an individual, use to overcome the problem or stress, like moving away. No, now, they are learned, adaptive, or maladaptive responses to anxiety based on our problem solving, and they may lead to change of behavior. Of course, that coping mechanism will involve higher level of emotional and ego development that defense mechanisms that we use unconsciously. Now, however, the overuse of coping mechanisms such as overeating or smoking can create problems. No? Like in the case of what you're going to do when you are always anxious, you eat. That is coping mechanism. But when you are anxious, but you paint, that is a defense mechanism because the unconscious process will actually tell you, you paint. It's a creative process that will be eliminating your anxiety. That is usually unpleasant. Let's say you are anxious, you go and decide to go to Corniche and walk is a coping mechanism. Or you smoke. This is negative, but at least it will reduce your anxiety. That's a coping mechanism. You understand the point. You don't know the difference between the two. Defense mechanism is an unconscious process that I am going to talk about later on, and coping mechanism is a conscious process that will help us overcome anxiety. As psychosocial practitioners, we need to understand this so that we can be very helpful to our patients. Okay? Any questions so far? You follow me? Okay. We'll continue now. Understanding some of the common defense mechanism that we unconsciously use. Denial is one. Let's say, for instance, you receive a call right now. Then the call tells you, hello, this is Aisha. All right. I am a doctor in this hospital. Your mother is here, and your mother just expired now. Your immediate reaction will be, no, it could not be. I was just talking to my mother a few seconds ago. Things like that. It's denial. You deny the situation that it happened. You see, according to definition, this is an attempt to remove an experience or feeling from consciousness. Example, the example that I gave you a while ago. Okay? Or somebody tells you, you have tomorrow, you'll say, no, it cannot be. I am living a very good lifestyle. You are denying the situation. You are removing the situation from the reality. Okay? But of course, eventually it will lead you to acceptance. The next defense mechanism that we use is called displacement. This could be positive or this could be negative. It depends on the distraction that you may actually have. What is the definition of displacement? The belief that one would be in great danger if true feelings about someone were known to that of a person, which causes the individual to discharge or displace feelings into a third person or an object. Let's say, for instance, you are angry with your workmate, or you are angry with your. So this is usually what's happening at home. You are really angry with your husband. For me, with my wife, but culturally, as a human being, I cannot hurt my wife. You see, the anger is already boiling. It's just that when I react, it would not be culturally acceptable. Like, for instance, if I'm a man and I'm going to slap my wife, or I'm going to slap to punch my wife, that will not be acceptable. What will I do? Displacement. If I'm going to see my son or other child there, in that immediately after that, I will shout at them. That is displacement. Channeling. Channeling the otherwise heavy emotion to someone else or something else. If I did not find my wife or my children there, maybe I'll find a cup and I'll just do this cup, and the cup would actually be destroyed or could be broken. That's displacement. Or maybe I'll go to the door and bang the door or punch the door. That is displacement. So in a way, the negative emotions that's actually boiling up inside me will be rechanneled through a person or an object that is actually very near. If there is no damage, then there will be a problem. There will be no problem. No, displacement is positive. But if there is damage, then it becomes also negative. That's why defense mechanism may either be positive or negative in a certain way. Now, identification is another defense mechanism that we'll be utilizing. What do you mean by this? No? So accepting the other person's circumstances as true they are one's own. I will act, talk, and think like the person that I know of. That is identification. Maybe I admire so much this person. What will I do? I will wear the way he wears. I will wear the dress that he wears. I will speak the way he speaks. I will behave the way he behaves. That is copying. So that this identification, I identify myself with him. I copy his behavior. And in that case, if I copy that, I believe that it will reduce my anxiety. That is the point. Next is intellectualization. That is separating emotion from an idea or thought because emotionally it's too painful. You need to intellectualize, you need to rationalize, give reason. Like when a patient discusses the physiology of his leukemia at length without any emotional reaction, he will discuss with you his leukemia, his disease, without any reaction, but deep inside, he is suffering. At least he's trying to tell you something about his disease. The next defense mechanism is isolation. That is blocking out feelings associated with an unpleasant or threatening situation or thought. Like when a nurse caring for a critically ill patient who is the same age provide care without experiencing the emotion related to tragedy of the patient situations. No, we try to block it. No, because it's really unpleasant. We tend to forget it. That is the thing. We black out the feelings associated with an unpleasant or threatening situation or any anxiety provoking situation that we experience. All right. I think I need to give you a break of 5 minutes. Please take coffee because our lecture will be a long way. No, I'm going to start with our 1.3 today also. Can we do that? Can we have a break for a while, class? You're there?
Yes, doctor.
Yeah. Can we have a break for let's say 5 minutes? Take your coffee.
Oh,
Yeah,
okay, doctor.
we come back at around 3:30 so that we'll complete this is 1.2, then 1.3 will start. Okay.
Okay.
All right. Thank
Thank you.
you. Don't go out. Just leave for a while now. Take your coffee. Okay, shall we start? Shall we proceed? You're still there? All right, so let's continue. As I was saying, a defense mechanism is an unconscious process that our body, our ego utilize in order to confront the anxiety that may compromise the ego as such. The anxiety is as a result of interaction between id and superego. So we utilize an unconscious process. There are so many forms, like in the case of projection. Now, projection is like in a movie house. You see, we do not see in a movie house. If we're going to look at the movie is projected from somewhere. Now, in applying this to us as a part of our defense mechanism, we don't look on our mistakes. When we are not going to look on our inadequacy, what happens is that we transfer or blame our inadequacy to others. That is actually the problem. See? Like, for instance, at work, you know that you are inexperienced. You know that you are incapable of doing things. So, what you do is that you blame someone. You will always tell, you are not good. You are not doing great. See? You are a failure. That is the meaning of projection. You are blaming others because of your inadequacy. That is actually the point. That is the meaning of projection. Okay? All right. Rationalization is another unconscious process, is another defense mechanism. We give reason, we substitute acceptable reasons for the true reasons for personal behavior because admitting true reason is too threatening and too humiliating. Like, for instance, you failed in your class, so your father actually tells your father asked you, why is it, what, give me the reason why you failed, instead of telling your father, I did not study during the examination, I was not listening to the examiner, I was not listening to my teachers. You blame your teachers. You're going to say, my teachers are not teaching me well, they are not doing good. You give reason because the real reason is that it would actually threatening, it would be threatening. What will your parents will tell you if you're going to tell, father, I did not study, father, I am not listening, father, I am not attending classes with this professor, that's why I failed. You tell another reason for it. You see, another one, of course, is reaction formation. Actions that are opposite of the true, unacceptable feelings that a person is experiencing. No? Like, for instance, a woman has negative feelings about her pregnancy, but then lavishes constant attention on her newborn. So that's the thing. That is the meaning of reaction formation. Regression is another defense mechanism wherein you revert back to your earlier patterns of development. Most of the time, when you are in prenatal stage, no? In order to reduce anxiety. Your behavior would always be a childish behavior, no? Like in the case of serious illness, a patient exhibits a behavior more appropriate for a younger developmental stage such as excessive dependency. You'll always be dependent from others. Feed me as if you cannot feed yourself. Bring me that as if you cannot actually go and pick that something else. Or maybe you'll just stay in one corner and regress. You assume a fetal position of the fetus. In that case, you are reducing anxiety. Repression is another negative defense mechanism that you may use. Why? You forcibly dismiss unacceptable thoughts, feelings, impulses, or memories from consciousness. Like, for instance, you are really angry with someone and you do not want to express that. So, in the end, you are repressing your emotion. You do not want to express it because in expressing it, you may injure, you may damage relationship among others. The basic example is that a person is unable to recall feelings of hostility toward a sibling or specific memories from childhood. There will be a problem recalling your experiences with your brothers or sisters eventually. Another one is sublimation, no? Expressing your repressed urges or desires in socially acceptable ways. Like, for instance, you are very anxious, you have this anxiety. What happens is that in order to reduce this anxiety, you tend to paint, you tend to write poetry, you tend to sing. So in that case, singing, painting, writing poetry would always be acceptable. And that is a defense mechanism that is actually very positive. Nothing will go wrong. Like, for instance, an angry person writes a poem about his reaction to his feelings. So whatever you produce in writing a poem, expressing your anger is a poem that is very creative. Or maybe you want to draw, so that's very creative. You want to do something creative or something special, that's creativity, that's sublimation. Okay, so that's one of the common defense mechanisms that we encounter. All right, so we start with the defense mechanism in there. Now we will proceed to understand also some coping mechanisms that we may use, that our patient may use. We have to recognize that after all, in mental health and in psychosocial health, the first thing that we have to assess will be the defense mechanism and the coping mechanism. We have to look at that. A person whose health, state of health is threatened, by all means, will reduce them into feeling anxious. So what happens is that a person may defend his ego using defense mechanism. That is unconscious process. We have to evaluate what are the defense mechanisms available to them. We have also to evaluate what are the coping mechanisms available to them before we can always suggest that they are actually psychosocially healthy. That's psychosocial health. Now, let us try to look into common coping mechanisms. Coping mechanisms are conscious process. When you have problems, you talk to other people. You see? Talking problems out with others and gaining new insights by other people's view or approach to the problem. See? When you have a problem, you just go. Sit down, talk with someone. Strangers, maybe a friend, maybe. Just talk and talk and talk about your problem. That's conscious process because you are talking it out with someone. You are not looking for solution. You're trying to find somebody to listen to you. Now, normally we utilize this in counseling because we recognize the fact that if a person is anxious or do have some things that bother him, they really would like to talk. So we come, they come, we listen. That's our job as counselor. You see? That's exactly what we need to do. If you know already the principles of counseling, your duty is really not to give it, so not to give advices or to give solution to the problems that your counseling will actually bring it out to you. Instead, your main advice is your main reason why you are there is just because you are there to listen only. Do not open your mouth, but open your ears. Close your mouth. That is the best help that you can give to any person who comes to you. Expressing intense emotion by crying yelling or laughing. This is different from displacement. When you are very afraid, you cry. It's a coping mechanism. It's a catharsis. Catharsis is a coping mechanism that is always healthy. You power your emotion. You express your emotion. Let someone see you crying. Whenever you have some intense emotion, you cry. It's okay to cry. That's a conscious process. Okay? Seeking comfort from friends. Or you eat favorite foods. Or maybe cigarette. Maybe treasured object like you just go and clean your car. Or buy something. Or consciousness altering substances like this is bad, no? Like methamphetamine hydrochloride, or we call it shabu. No? That's a coping mechanism. Using humor to discharge tension in a way that avoids fully acknowledging a difficult situation. You make a laughing stock out of yourselves whenever you have encountered problems. That's a conscious process. These are some common coping mechanisms that we use. No? Number 5, exercising or performing manual labor to relieve tension, like you just go to the corniche to forget about everything. That's coping mechanism. It pays to help, to walk, it pays to jog. Or maybe you just clean the house. You notice that when your mother is always angry or anxious, sometimes they could actually turn the house upside down. That will be very good also, because you could redecorate the house, you could rearrange the house. But otherwise, a boring house may become a lively house once again. No? And then problem solving using a series of strategies and step-by-step approaches to the resolution of a problem. So you try to solve your problem consciously by trying to find solutions step by step, step by way. Then another one, of course, is sleeping. You have anxiety, sleep. This is unhealthy because when you wake up, still the problem comes. Yeah, but at least you avoided it for a while, or maybe you let your brain process the information so that when you wake up, you hope that everything is there. At least the intensity could actually be reduced when you are going to sleep it out. That's why we keep on telling people, if you are going to make big decisions, do not decide immediately. Sleep over it so that whenever you can actually wake up, there will be a new decision. You change your perspective. Like this is similar way when you do have severe anxiety or anxiety provoking or threatening event that happens in your life, sleep it over so that the intensity of the reactions that we may have will be changed. The intensity now is higher than the intensity tomorrow when you're going to wake up. So sleep over is actually a very good thing also. Avoiding upsetting situations, for example, by let's say pretending to be ill, or avoid confrontation, just like for instance you are invited to attend a dinner, and you're afraid that you may see someone that you hate, so that when you see that someone, it brings your blood pressure high. So yeah,
It
you
happens
experience,
to me, Dr. Thomas.
you experience this, right? Instead of avoiding it, so what happens?
Yes.
What do? You do not go. You say, I am sick. Yeah.
Yes.
This is to avoid confrontation. No, this is good one way or another. It's a coping mechanism, but don't overdo it. Coping mechanism, conscious process. Do not overdo it. Okay. Yeah,
Yeah.
that is the thing. At least you know. Now, these are the things that you have to recognize from sick people. Sick people tend to cope using coping mechanisms and defense mechanism. So the natural thing that we are actually going to that is the defense mechanism. This is unconscious process. It comes while coping mechanism becomes intentional because this is a conscious process that you decide on what to do. No, so we are going to look into this at all times. No, so that's some common mechanisms that we are using every now and then. To conclude this unit, there will be another start. Now, nurses will encounter in their patients wide range of psychosocial response to illness. By all means, we are going to encounter different patients, different people, different way to cope with psychosocial problems that they may encounter. They may also have different reactions to illness that they may actually have. So we have to recognize that so that we may be able to help our patients. Understanding these types of responses and knowing what to expect will always help us to give better care to our patients. So by basic understanding of what we have and what they are the patient about will always be very helpful to us. Wherever you go, whatever you do, you will be very helpful. You see? Of course, assuming that you as nurses, we as nurses, have to take care of ourselves first. No, that's the basic idea behind this. We can only give psychosocial care if we know how to take care of ourselves. That means to say we understand all about this as we go. Okay, so that's 1.2. Any questions so far on psychosocial response to illness?
No, it's clear, Doctor.
Very clear. Now, so I will go with number 3 now. I'm very sorry because this is up to the 2-hour class. At least in between, I give you a break, but maybe I will dismiss you early also, no? So that 2 hours will be very difficult now. But anyway, I'll try. I'll try to start this. Then let's see what happens next. Okay. So I would like to present to you the next chapter, which is psychosocial skills. Now we understand already the capacity of our patient. We understand also how the patient reacts whenever illness comes. Now we have to make it sure that we are equipped with psychosocial skills that we know our patient will be utilized and we know we ourselves will utilize also to take care of our person, to take care of our psychosocial health. By the way, every single person needs to do that. Even though you're a nurse, it doesn't mean to say that you are going to be healthy. Even though you're a psychologist, me as a psychologist, there is no guarantee that I will forever be healthy. No? So that means to say I need to have a psychosocial skill to overcome all these uh, reactions that I may have out of illnesses. Okay? So still this is the chapter 3 of your textbook. This is still the third book, no? Have you seen the third book? The cover is red. Did you download the book? I hope you read, no? This is Psychosocial Nursing. Now you just click it and you can download it. Now, did you download it? You have it?
Yes, Doctor, we downloaded it.
Oh, very good. No, you read with me, no? Because these are very simple books. We utilize 3 books. Hopefully, this will actually help you. Now, I really would like to emphasize this. Now, providing psychosocial care requires a combination of astute psychosocial assessment skills. We will be able to assist. No? Experience in performing mental status assessment, and at the same time, you use therapeutic communication. We use 3 here. Number 1, our psychosocial assessment skill. How do we assess our patient? Isn't it? As nurses, we are expert on what we do. Yeah. When we see a person displaying a certain behavior, we know what to do. We know a person is sick whenever they display specific symptoms. These are the things that we look for. Now, in psychosocial health, similar way, we know how to assess so that we will be able to find out what to do. We will be able to do MMSE, and of course, eventually, we will use our therapeutic skills in communication. Most of the time, we use this now unknowingly. Now, when we talk to our family members, when we talk to our children, when we talk to our husbands, our wives, sometimes we could be therapeutic as we can. Okay, we'll be surprised. So this is exactly the main point while I'm presenting this chapter. No, so as a nurse, we should be aware on what we can do in terms of psychosocial nursing assessment. We have to do the following, no? Number 1, take note of this. The presence of psychosocial problems in a patient has a strong influence on the diagnosis arrived at and on the course of treatment chosen. So we are going to look into the psychosocial problems. Isn't it that in our nursing process, the first thing that we are going to look into will be observable then unobservable behavior. These are the things that are experienced by the patient, and later on, these are the things that we observe, okay, with evidence, so that we will know what to do. How do we know if the patient will not verbalize the problems that they may have? We observe their behavior because we know for a fact that their behavior is a reflection of what they think. So we record and we solve. That is exactly what we can assess the problem by looking at their actions. We know a person to have some problems, to have some sort of, let's say, psychosocial problems by way of observing what they do, by means of their actions, we can say. No? With a thorough assessment, if we know how to assess that, I'm going to teach you eventually, the nurse can determine the patient needs, will be able to know the needs of the patient. We cannot just supply the needs, we need to find out the needs of our patient, the problems, the potential problems, and then identify patients who are at higher risk for developing more serious problems. The main concern that we have in psychosocial nursing, this is the first and foremost, is the preservation of life. We are always going to assume that a person who do have psychosocial illness may commit suicide. So we initiate suicide precaution. Then after that, we have to assess. That is usually the point. That's usually the case. In United Arab Emirates, we know for a fact that suicide is unlawful. But of course, human as we are, other people still think the way they think that this is the easiest way to escape from the problem that they may have. So they may think about it and they may attempt it. So that's why we are going to place every single person with psychosocial problems on a suicide watch. Okay? Because as a nurse, our main concern is to guarantee that our patients will live, not will die. Okay? Now, information to be gathered in a psychosocial assessment includes the background, very essential and very important. Now, as a psychologist, background is very important. What is the meaning of sociocultural background? Where they are from? We are going to respect the cultural connections that they may have, the cultural practices that they may have. We are going to look into emotional and biological aspects also of current problems. What are the most common coping mechanisms or defense mechanisms that they intend to use or that they are using? Remember, a person who is confined in psychiatric ward are those person or those people who run out of coping mechanisms and defense mechanisms. But you know that sometimes their coping mechanisms and defense mechanisms will be reduced to zero. So they are dependent on others. A person who is actually healthy, even though you do have psychosocial problems, you may still get over it because you have plenty of defense mechanisms to use for or coping mechanisms to use. No? We are going to look also into spiritual and philosophical beliefs and also family issues. These are very important things. So that's why we have to look into family history. We're going to look into their experiences. Who knows, we will discover something. Maybe when they were young, they were abused by their parents or they were abused by their relatives or any person that is very significant to them. Now, in psychiatry, in mental health, in psychology and psychosocial nursing, these are exactly the main points of what we look for. Not human experience, because we believe that human experience is what makes an individual personality when they grow up. Our our personality right now is the sum total makeup of our experiences that we could have experienced in the past when we were children. Okay? So moving forward, these are some of the key issues in response to illness. So the lifestyle information, these are the key points that we have to look into. It will determine whom the patient lives with, as well as the patient's significant relationship Available support, people, marital status, occupation, religion, and other on this. What kind of lifestyle that person may actually live beforehand. The next one, the normal coping patterns, the coping mechanisms that they are using. No, these are the key points that we will actually use. The key or hospitalizations. No, questions that can be asked include the following: what happened the last time the patient was under severe stress? What did this individual actually used in order to cope with the illness that he may actually have? How is the patient currently coping? No? How are you coping? What helps in stressful situations you are actually getting? So these are exactly the main point that I'm actually telling you. Now, if a person is coping properly, then there should always be available coping mechanisms that we will be able to use. The moment it actually runs down, it runs to zero, then there will be a very big issue. There will be a very big problem. You see, the tendency is that the patient may actually develop pathologic case, right? Other than the reaction to the illness that they may actually have, maybe the patient may develop psychological illness, psychiatric illness. That will be a problem. We have to look into that as we go. No? Now, the basic understanding of the current illness, you see, our job is not only to look into the welfare of our patients, to take care of our patients, to give care, to educate also. Now remember, when the patient comes into the hospital, they are the patient of information. So what do? We have to supply that. But of course, before we are going to do that, we need to assess the basic understanding of the current illness that they may actually have. Therefore, you as a psychosocial nurse, you as a nurse should ask the patient about his or her understanding of the diagnosis or reason for seeking medical attention or advice. And after that, you determine how the patient will view the illness affecting or his or her life. So if the patient has a basic understanding of his illness, then you can be very helpful already. So you can make it sure that whatever you do, the patient may understand it. Because the patient may have has a basic understanding of his illness. Sometimes the patient come to us because they don't understand. If the patient don't understand, the patients do not understand whatever they have, whatever afflicted them, it breeds anxiety, it breeds fear, it breeds severe problems that they may encounter. You see, so it breeds insecurities among others. So we'll assess if the patients do have a complete understanding, or if not, then we will do patient education. We are ready to educate our patient so that they will alleviate another offshoot of psychological illness that may arise because of these problems that they may encounter. Now, the personality style of the patient, if the patient is ongoing. Now, it pays to understand who and what the patient is. After interacting with our patient, we need to identify any important personality traits that may affect or his or her care or compliance. You have to look into that, such as the tendency of our patient to be dependent. Dependent means to say they cannot judge on their own, they do not know what to do, so they are expecting others to do that for them. Or they may be hostile. That's why we kept on telling that they are rude, no? Or they may be very dramatic, they're crying as if they really would like to seek your attention, no? Or maybe critical. So we are going to look at that critically in such a way that everything that you do is wrong. That is the meaning of this. Not life-threatening, but they are looking into whatever actions you do as something like it's going to be wrong. There must be some problem. No? Then you are going to look into the history of psychiatric disorder. Now, if the patient is currently taking medication for psychiatric problems, we should know that because we should know who our patient will be. Now, unfortunately, if we are going to live in our society, we are going out, there will be so many people who are actually encountering or suffering from mental disorder or psychiatric illness, but they are undiagnosed. They could not have seen any psychiatrist or psychologist at that. So unfortunately, there are no prescriptions, but there are other people around us also who have seen the psychiatrist and there are prescriptions. So we should know that. What are the current medications that they take in so that we can always relate into relate that with our psychiatrist, place that in our record so that those people will read, will understand because you see, in psychiatry, a combination of different medications may actually endanger the life of the patient. So we should have a very good combination. A wrong combination will kill the patient. Now, consider asking if the patient has experienced any psychiatric symptoms in the past, like in the case of hearing something, although the source of the noise could not be there. Seeing something, these are hallucinations, maybe delusions also. As a nurse, you should know that, no? Or they could have actually experienced depression in the past. So these are exactly what we can actually observe or we need to observe from them. Right? Recent life changes or stressors determine if there have been any major changes or traumatic events recently. So it is a challenge for us to keep, no? Especially asking the patient to recall difficult situation, painful situation that they could have encountered in the past. Now, always keep in mind that these changes may be both positive and negative, but most of the time, negative life experiences tend to breed negative mental attitude or mental reaction. Of course, moving to a new house could actually be viewed differently as it could be negative or it could be positive. It depends, no? A death in the family will always be negative. A job or a role change will always be a challenge, will be negative, no, or positive. Or the recent birth of a child, this is always positive, but sometimes it will stress the patient. That's why there will be what we call as postpartum depression, no? So this is always associated to this. So we are going to look into some changes of life events of your patient. So we'll be able to discover, we shall know, we must actually know. Then, of course, spirituality, how spiritual your patient is. You know, as a nurse and as a psychologist, spirituality is this is the leading source of my psychology, you know, because it will determine the role of spirituality. It will actually help the patients to go over whatever challenges they may actually have. And of course, you have to determine the role of spirituality and religion on the life of your patient. How religious, how spiritual your patient is. Now, but of course, when you are going to assess this, use hope assessment in order to look for spirituality of that person. What is this hope assessment all about? Hope, it stands for sources of hope. Sometimes we lose everything except God. You see? Then who is the source of our hope? Allah, God. Always, nothing will go wrong if we are going to breed our strength from God, our comfort from God. We have to look into that, no? So, how spiritual your patients will be. And of course, as a human being, how spiritual you are. Whenever you encounter problem, whatever you do in order to restore hope, pray, isn't it? The next thing is, oh, the role of organized religion for patients. You are going to look into the role of organized religion for patients. Then P, personal spirituality practices, no? And E, you're going to look into the effects on medical care and end of life decision of your patient. These are exactly what you need to do, no? So hope. So determine the spirituality of your patient. The more spiritual the patient will be, the resilient will be ever be, provided that spirituality is very positive. That spirituality is just a normal, because there are so many people who are very fundamentalist, no? So that spirituality is something like twisted. So spirituality that is experienced by people, the role of religion in the recovery, the role of religion in the development of the symptoms, and so on. And then the major issues faced by current illness. Okay, so determine how this illness has affected the parent's lifestyle or sense of self, including areas such as self-esteem, body image, loss of intimacy, role changes, and change in family dynamics. So you look at that. Is there anything that transpired in the family? Is there any that in the family? Is there any marriage in the family? Did you transfer from one marriage to another? Did you lose money? Big time. Did you win money? Big time. Did your husband, or was your husband reassigned to some key city in United Arab Emirates? Or was your husband assigned in Yemen or any other areas of the world? So things like that, no? Because these are some major issues. Let's say, for instance, if you are married to a soldier and the soldier is assigned somewhere else to a very dangerous post, so of course, definitely it will affect your psychosocial health. So we have to look at that, no? Major issues raised by current illness. And of course, the mental status examination. We should know how to do this. From head to toe, perform the mental status examination in order to help identify dysfunction in. Hello. Yeah. Mm-hmm. No issue. Okay. Email. Yes. Yes. Okay. Okay. Hello. Yes. I'm very sorry. No, Dr. Vimala called. So I will teach you how to utilize mental status examination. No, to help identify dysfunction in emotional, cognitive, or behavioral spheres. It's very important for you to know this. Although in psychiatry we're teaching you about this, but of course as a general practitioner, for the meantime, I do not know which area you are going to come in whenever you are going to enroll in our master's program. Are you going to be in adult health, or are you going to be say, in psychiatry? Is there anyone who will
And
be in psychiatry here? No
I
one.
am choosing adult health.
Adult health nursing.
Yes.
Others community also. We have midwifery also, you know.
No need.
Masters in, masters in midwifery, we have that. Something, it's the potential is too much in midwifery. You know why? You can actually establish your own, especially if you are a local, no? You can, if they will accept that later on, in eventually you can have a birthing clinic, no? This is a trend in other country, right? Birthing clinic, so you have a clinic on your own because you're a midwife. You see, that's the thing. Or every other area is actually very important. Adult health also, you're going to encounter so many issues like this eventually in the future. Yeah. So you are
Yeah.
going to be in adult health community. No one.
Inshallah.
At least you are going to secure your seat already, because we are giving only few seats right now, 4 students per area. So we have 5, so at least we'll be admitting 20 students. So when you finish this, you are securing already 3 seats. Huh? Yeah. Okay. So any questions so far?
No clear, sir.
Are you are tired for the day, or you would like to go on and continue? Or you
Okay,
would
we
like,
can proceed.
we can proceed now? Maybe we can actually take 15 more minutes. Yeah. We'll finish around 4:20. Okay. Then we call it a day during that time. I really would like to start first with the psychosocial nursing assessment. This is very important because as nurses, we have to look into the psychosocial health of our patient. In medical world, in surgical world, sometimes we tend to overlook psychosocial issues of our patient. We only look into psychosocial assessment if we are going to deal with patients who display psychological problems. So this is usually the main point that we may actually have. But normally, in other areas like in medical or surgical ward, there are the psychosocial problems will be the main problem that your patient will encounter. No, so that means to say it's more on problems with self-esteem, problems with anxiety. So you have to assess that. You have to look into it. No, so this is what we are going to do in order to come out with a very good psychosocial nursing assessment. You need to create a very appropriate interview environment. You do not just actually go and stand with your patient. Something like the patient may actually want privacy also before they can tell or intimate with you whatever they have. Remember this. Whenever you're going to have a first encounter with your patient, that will be very difficult. Why? Because the patient may not give information, very sensitive information to you. They are going to hold it back. You know why? They may not have, or you may not have as a nurse established the trust, right? Sometimes information will be very difficult to get, isn't it? So one way of, yeah, very good. No, one way of achieving this is actually by providing pharmacy so that you will assure that your patient will actually tell you that thing, not will assure that you and the patient will have this information utilized only for that basic purpose of diagnosis. So that's the thing. So you assure that any information that you will gather will not go out, will not be known except by the doctors and those people who will take care of the patient. You have to recognize that, no? So it will be very helpful if we're going to provide a very quiet environment, no? So you create a quiet, private space. Of course, you have to minimize interruptions if possible. In the world, there are so many interruptions. Patients come and go. Doctors come and go, nurses come and go. You see, we have to find a place where everybody, where the patient and you will actually concentrate and will actually be very private, and somehow the patient may, let's say, be at ease in giving the information that you want to know. You maintain appropriate eye contact. This is the secret, no? So you do not let the patient in controlling the situation. This is happening in so many areas, particularly what I actually mentioned to you earlier. The moment that you do not actually do have eye contact, then the patient will take over you. The patient will control the situation. You cannot get any information that you want. But the moment you initiate eye contact, you will be in control. The patient may actually be, you know, coerce, if the right word is coerce, give information that you require, that you need. No? Because it entails authority. But of course, do not assert that. This is what we call as the unspoken language. Uh, Sit at eye level with the patient, just like what I'm doing right now. Okay? Making sure these are some techniques that we be using later on in establishing a relationship, no? Nurse-patient relationship, therapeutic communication. But of course, initially we're doing this already. At all costs, anywhere we do, where we need to do that, no? We sit at eye level with the patient, all right? Ask open-ended questions so that the patient may not answer yes or no. Something like, it will be better for us to ask open-ended questions so that the patient will have the liberty to give the information. Sometimes there are talkative patients who give so much information in one question. Let's say when you're going to tell me the condition why you are seeking medical treatment now. So it's an open-ended question. So the patient may actually give information as they think it fits or it's necessary. No, it's unfiltered communication. It's unfiltered information that they would like to give. Avoid writing a lot of notes during the interview. This is the thing. When I am teaching the patient, when I'm teaching my student in psychiatry, I forbid the use of pen. I forbid any notebook. You know why? When you are going to interview the patient, something like the patient may distrust us because we keep on writing. So you just actually retain your memory, all right, so that there will be a time for you to write. Just like when you're going to communicate to the patient, it will be a casual communication. Now the problem right now is that it's happening in any world all over the country, where everything is actually run in the computer system. We use what system, you use your other system. When we interview the patient, it's direct. So we ask one question, we have not digested it, then we enter. Ask question, we have not digested it, yet we enter. So that's the thing. There is no continuity. There is no therapeutic relationship. There is no therapeutic communication for that purpose. The only reason why you are communicating is because you would like to get information. Don't you know that in psychosocial nursing, therapeutic communication is the key. When you are going to communicate with your patient, you do not know that you are already helping the patient. You see? This is one key secret. Why is it that we need to communicate with our patient? No? Then of course you have to demonstrate your interest in patient's concern. You have to show that you are very concerned to the situation or condition of your patient. And in order to indicate acceptance of your patient, you avoid criticism. Do not even challenge. Do not even frown whatever your patient will tell you. Do not even show or demonstrate check like, huh? Something like that. Do not do that. No? Just nod your head so that you can always tell, go on, I'm listening, tell me more. Yeah, interesting. Things like that, so that the patient will be encouraged to talk better. That is the thing. Do not ever challenge, do not do not criticize, do not even frown. Frown. When you are frowning, as if this expression of disbelief. Avoid asking more personal questions than are actually needed. But in doing psychosocial care, you should know when to stop. You should know what are these. Now, initially, you will not do that because some very personal information may actually be secret for the meantime with your patient because you have not established the trust. But in psychosocial nursing, the moment you establish the trust, that will be the time that you can actually get sensitive personal information from the patient because our main goal is actually to know the background of your patient. Our main goal is actually to look into the experiences of our patient, right? Not necessarily from the time that from the time the problem has been manifested, we have to go as far as we could. That means to say, we have to go as far childhood as the patient could have remembered. That is the thing. Now, determine whether the family can provide information if the patient is unable to communicate. In the hospital, usually there will be family members, but if the patient is brought about by a stranger, that will be a problem. So we have to determine if the stranger will actually, or anybody who brought the patient in the hospital could actually give more information as they wish. Then the most important thing that I am actually maintaining to you, that I'm telling you is maintain confidentiality. So you have to make it sure that the patient's trust actually will be regained or gained by trying to assure them that you are going to have full confidentiality. That means to say any information that you will get from that conversation, from that communication with the patient will not go out, except it will be used only by attending physicians and other nurses who will continuously do the caregiving. No? And be aware of your own biases and discomforts that could have influenced the assessment. Something like there are people, this is actually the person's tendency. Every human being has the tendency to judge and be biased to somebody else. When they see one thing, it's already there and nothing can be changed. You avoid that. As a nurse, you should know that we are going to operate and understand the disease of the patient based on what we observe, what we get. That is the thing. Now, keep the focus on the patient, not you. In psychiatry, also, it's the same way. You have to focus on your patient, not you. Therefore, when the patient is communicating, when the patient is telling something, you tell you know, no? And in approval, that means to say you're listening. Okay? So, any questions so far? I think I have to stop here. I believe you are tired also because you have continuously 3 hours from 1:30. So I'll meet you on Thursday. Okay, Thursday I think on the same time. All right. Is there any question that you would like to ask?
No, it's clear, Doctor.
Very clear. I will no issue if I'm going to upload the video again.
No.
No issue, right? So that will be okay, isn't it? After all, no one is looking at your faces,
Yeah,
isn't
yeah.
it? It's only my face that is shown there. So for me, I don't have any issue with that. Now, I think it will help you also, just in case you really would like to review whatever the day's class we have, then you can always look into that. Okay? Expect that later on. All right.
Thank you so much, Doctor.
All right. Have a good day, everyone.
Thank you so much.
All right. Bye bye.